Thank you, Mr. Chairman. Let me make the observation that once again, you and Senator Murray are working together in bipartisan fashion with the rest of the members of this committee to address an extremely serious problem that we're facing in this country, and I thank you for your leadership. And somehow you are always able to pull the chestnuts out of the fire and get something done. I want to thank the staff for working with my staff on legislation that I would like to introduce in behalf of Heidi Heitkamp, who is my co-chair of the Senate Rural Health Care Caucus with regards to telemedicine. So thank you for your efforts. Ms. Nickel, Senator Collins referenced your testimony as being very poignant. I was trying to think of a word that could trump that. I don't think I can. Thank you for that testimony. And I hope I'm not out of order in stating that I feel very sure that your mom and dad are very proud of you with regards to what you're doing. And putting a face on this terrible scourge in our country with Courtney, Larry, Emmett, and Dylan, that's the way to approach this, Mr. Chairman. I think we really need to do that. We can get some things done. You made some suggestions on page 8 where you talk about getting our schools involved, which I think is pretty much a common sense approach, and would recommend that to our leadership here. You say comprehensive school community-based assessment and early intervention activities and programs such as student assistance programs. There's an acronym for that. Everything has to be an acronym, SAP. I don't think we're SAPs for considering it, but at any rate, in middle and high school settings can play a critical role in stopping the addiction cycle, and I certainly agree with that. Then I'm popping over to page 13 where you address telemedicine. I've heard from many Kansans who have had to travel long distances, sometimes across state lines, in order to access any kind of substance use treatment. For example, the nearest methadone clinic for Southeast Kansas is in Joplin, Missouri. We Kansans still, when traveling to Missouri, it's a traumatic experience, Mr. Chairman. We're always glad to get back, but that shows you what we're facing. Both Senator Heitkamp and I are very interested in telemedicine's potential to assist these patients in receiving the necessary diagnosis and treatment. We've been working with telemedicine just in terms of access to health care for a long time. So, Ms. Nickel, what services can be used via telemedicine to best treat patients with substance abuse disorders?
So telemedicine is a key component to meeting our treatment capacity gap that we have. Right now, only 10% of our 21 million people that need treatment are going to receive it this year. Can you imagine if 10% of cancer patients receive treatment? And in particular for rural communities, telemedicine can be a game changer on getting the treatment components that you need for a long-term recovery plan, treatment and recovery plan. And there's a couple different pieces of that. One is treatment itself, telemedicine capability for prescription of medication-assisted treatment, which is particularly important if you're in a rural community and you don't have a provider that's even within hours of a drive, and you need to be able to have that medication for that patient, but also telemedicine for counseling services, for behavioral health support, and even interventions such as cognitive behavioral therapy. And there's some red tape that exists that makes this difficult to deliver these services across state lines and to streamline the availability. So all of these different components made available through telemedicine could be a game changer.
I appreciate your response, Mr. Chairman. I also want to thank Ms. Donahue and Mr. Morrison for their contribution. And I'm going to yield back time, which I know is most unique for me, but...
Well, Mark, that is an important event. Thank you very much. Thank you, Senator Roberts.